Hello, I'm Dr. Brandt Gibson, and today I would like to talk to you about Tailor's Bunion. And as we've been doing in many of the common deformities, many of the common problems that we're getting here in the foot and ankle is, I want to talk to you as well about the deformity of a Tailor's Bunion through answering those four questions. So number one, what is a Tailor's Bunion? The truth is, a bunion typically is on the first metatarsal on the inside of the foot, where the first metatarsal turns out and the hallux or the big toe turns in. For a Tailor's bunion, the fifth metatarsal, the smallest metatarsal, turns out and the little toe turns in as well. So you get the same type of prominence, same type of problem, same type of discomfort in that area, and you can actually can be pretty problematic. And so in that case, Tailor's bunion is a prominence of the fifth metatarsal. As you get continued pressure there, just like the first metatarsal on the bunion, this will grow and get bigger, and it becomes more and more of a problem. And because of that, you actually get pretty significant discomfort, and it can be problematic in that case. So a Tailor's bunion is the prominence on the outside of the foot. Why does it happen? Number two, the big reason why you get a Tailor's bunion is genetics, for lack of a better term. Genetics is the key reason that it happens, but you can also get increased problems in that area because of tight shoes, because of activities that you're doing, because of the way that you walk, which is part of the reason that genetics causes it. But the biggest thing is it will continue to be a problem just because you have the genetics that's going to actually lead to a prominence in that area. Number three, how do you treat this at home? Just like a bunion, where it's a little bit difficult to treat it, you're really just saying, okay, I'm going to wear wider shoes, I'm going to pad the area, I'm going to reduce the pain, reduce the problem, those kind of things. The truth is, with a Tailor's bunion, in this case, you're going to do the same type of thing. You're going to take pressure off of this area. You can actually use anti-inflammatories or ice to decrease the swelling. You can actually use padding. You can use wider shoes. When should you go see a doctor? The truth is, with a Tailor's bunion, I recommend that it's treated more aggressively when it starts to interfere with life. So if you have significant pain, significant discomfort, starting to keep you from doing the activities you want, or even keeping you out of the shoes that you normally like to wear, you may want to consider doing something more permanent, and that is doing some type of surgery to fix the prominent fifth metatarsal. The most common is you actually cut through the metatarsal, move it over, similar to what you would do with a bunion, and you actually fix this problem. So if you have a Tailor's bunion and it doesn't hurt, it just is prominent and it limits some of the shoes you wear, but it's not really a problem, you can actually continue to just function normally and not have to have it treated. But if it starts to become pretty problematic, pretty painful, then you should see a doctor of some sort and actually be evaluated for that problem and go through the treatments to actually help it resolve. This is Dr. Brandt Gibson, and this is your Podiatry Tips, Day 159, Tailor's Bunion. Again, my recommendation is that you treat it when it starts to interfere with life. Thank you, and have a great rest of your night.